The Royal Commission into Defence and Veteran Suicide in its final report had a recommendation that government needed to increase what it paid to a range of medical practitioners that service our veteran community, including allied health professionals. And indeed, veterans had been telling us as well that sometimes they were finding it difficult to access allied health services that they needed because of the fees that DVA would pay to those practitioners. And the professional bodies that represent those allied health professionals were also saying to government that they felt that the fees we paid were too low. And so in this year's federal budget, we are committing $169.7 million to increasing the fees that we pay to those allied health professionals that provide services to our veterans. And this represents the biggest increase in fees in 2 decades. So it will mean that it's easier for veterans to be able to access allied health services that they need. As part of this increase in fees, we're also getting rid of the treatment cycle. And the treatment cycle was a requirement that a veteran go back to see a GP after every 12 allied health sessions to get a new referral. And that was a method to make sure that veterans still had a clinical need to access those allied health professionals, but also to make sure that there wasn't any over-servicing going on. But it was very burdensome on veterans having to continue to go back to their GP, and it also meant that GPs were spending a lot of time just doing these re-referrals. So we're getting rid of that treatment cycle, and instead we're introducing a $5,000 annual monetary cap on allied health services for our veterans. Now, the vast majority of veterans, they won't get anywhere near that $5,000 cap. But for those who might get near that or go over that cap, but still have a clinical need to be able to access allied health services, there will be a way for them to be able to get that approved so they can keep getting the care and the services and support that they need from allied health professionals. Providers, what they're going to see is quite a significant increase in fees. So for example, for podiatrists, for exercise physiologists, their fees currently paid by DVA are around $75.10. This will go up to $110. And for a psychologist who currently is charging about $163 or being paid $163 by DVA, they'll now be paid $260. So again, a significant increase to allied health professionals, and we'll see those sorts of increases reflected across the board. It's the biggest increase in fees to allied health professionals in 20 years. Now, these changes kick in from the 1st of July 2027. That's over a year away, and that means that there's time for DVA to work with ex-service organisations, the veteran community and the practitioners themselves around how we implement these fee changes, but also making sure that veterans, if they're approaching or are going to go over the annual fee cap, have a way to be able to do that if they've got a genuine clinical need to access those allied health professionals, making sure that that works as seamlessly as possible to support our veterans in getting the care that they need and deserve.
I'm here with Scot MacDonald, our General Manager of Policy and Advocacy, and we've been in Canberra this week following budget announcements. What have been your thoughts, Scot?
Yeah, look, I think we've had a range of really effective meetings with ministers and senior public Department of Health officials. 2 of the meetings I think really stood out was the meeting you had with the Minister Keogh, and then latter one with Minister McBride on mental health. So yeah, Keogh was very important.
It was great to meet with Minister, particularly following the DVA announcements with the increase to exercise physiology fees, and it will be an ongoing conversation, particularly as we seek clarity around the caps for allied health annually.
My name is Dr. Rick Dawson, and I'm the National President of the Australian Physiotherapy Association. I'm also a gerontological physiotherapist with more than 30 years of clinical experience and currently a postdoc researcher at the University of Sydney. Across Australia, physios work very closely with veterans to support recovery, independence and quality of life. That can include helping someone manage chronic pain, recovery after surgery, improve their mobility, or regain confidence following physical and psychological trauma. We see these recent announcements as a very positive step forward for veterans' healthcare. For some time, physiotherapists have raised concerns about the sustainability of delivering care within the DVA system, particularly as funding struggled to reflect the complexity of care many veterans require. In some cases, that created barriers to access. Our hope that these changes will improve access to allied health services, including physiotherapy, and help more veterans receive timely support to stay active, independent and well. Physiotherapy is not just about injury management, it supports mobility, pain management, rehabilitation, mental well-being and quality of life. And evidence shows that early rehabilitation and ongoing physiotherapy care can improve long-term health outcomes and reduce hospitalisations. I also encourage veterans to connect with their physiotherapists and have a conversation about the support available to help them maintain their health, mobility and independence over the long term.
My name is Diana Poole and I'm Chair of the Australian Orthotic Prosthetic Association. We're the peak professional body who represent certified orthotist prosthetists across Australia. So our members are allied health professionals who work with veterans every day to support their quality of life. That includes providing prosthetic limbs for veterans who live with limb loss, things like orthotic supports for musculoskeletal and neurological conditions, and ongoing clinical care to help people remain active and engaged in their communities. We've been involved in advocacy and engagement relating to veterans, and this has included things like discussions with DVA and broader allied health policy forums. One of our key focuses has been to ensure that veterans can access timely, safe and high quality care which is delivered by qualified professionals. We really welcome announcements that recognise the importance of allied health in supporting veterans' health. For many veterans, allied health services like orthotics and prosthetics are essential. They enable mobility, they reduce pain, prevent complications, and can help people to continue to participate in things like work, family life, and their community. From our perspective, improved support for Australia's veterans will help reduce delays in accessing care, improve continuity of treatment, and ensure that veterans can receive clinically appropriate care. It's always critical that funding settings and policy frameworks recognise the real complexity of allied health services. In particular, highly specialised areas like orthotics and prosthetics, where care can involve ongoing engagement. It can include things like assessment, orthotic and prosthetic provision, fitting, education, and long-term review. Ultimately, the goal should be to ensure Australia's veterans can access the right care at the right time with as few barriers as possible.
The Royal Commission into Defence and Veteran Suicide had 122 recommendations in its final report, and we've been working through implementing those recommendations, and we had 32 of them implemented by the end of last year, and we're on track to have 2/3 implemented by the end of this year. And of course, our uplift in fees to allied health professionals goes part of the way of implementing one of the recommendations of this Royal Commission. In the budget, we've also set aside $770 million going forward to help with the implementation of further Royal Commission recommendations. We're committed to implementing the recommendations of the Royal Commission because we know how important it is for our serving personnel, for our veterans and their families to see an improvement in culture, to see an improvement in healthcare and service delivery, and taking that broader wellbeing approach to support our defence personnel, veterans and families.